Hello, I'm Dr. Erin Pennison from Terrebonne General Medical Center. Today I'll be answering a question from Rose in Houma. Rose asked, what is endometriosis and what are some symptoms? Well, Rose, endometriosis affects approximately 7 to 10% of the population, generally in young females in their 20s and 30s. Endometriosis has thoughts to have many causes. The most generally accepted cause of endometriosis is that blood that is extruded through the cervix during the menstrual cycle can sometimes also be extruded through the fallopian tubes and implant inside the abdomen. These implants can land on the fallopian tubes themselves, on the ovaries, on the ligaments that hold the uterus in place, on the bladder, or near the rectal area. Depending on where these implants are located will also depend on the symptoms that they cause. The main symptom is pain, and the pain may be severe in nature, especially around the time of the menstrual cycle. Pain can also occur with intercourse. It can occur with having urination or bowel movements if that's where the implants are located. The severity of the pain is not directly related to the number or the size of the implants that we find inside. Generally, the pain is just case dependent. The only true diagnosis for endometriosis is laparoscopy. Laparoscopy is a procedure in which a lighted telescope is placed through the abdomen while the patient is asleep. We can look for these implants, and at the time of laparoscopy, we can also do treatments. The endometriosis can be removed surgically by biopsy, laser, or fulguration with a cautery type instrument. Other non-surgical treatments for endometriosis would include birth control pills or other birth control measures such as the birth control injection. Non-birth control treatments would include a medicine called Lupron, which is a hormonal treatment that will actually place the woman in temporary menopause and help the endometriosis shrink. The risk of not treating endometriosis can be great. They can lead to scarring near the fallopian tubes and ovaries, which leads to severe pain and can lead to infertility in young patients who are wishing to have children. Generally, patients who are wishing to have children, we recommend surgical or medical therapies to see if the tubes are open, if the endometriosis is one of the reasons causing the infertility. Generally, though, most patients will benefit from hormonal therapy, either with birth control pills, the birth control injection, or simply mild pain medications. If any of these symptoms occur and last for more than 2 to 3 menstrual cycles, you should contact your doctor and be evaluated for endometriosis. Well, Rose, I hope I answered your question. This has been Dr. Erin Pennison for Ask the Doc.